Okay, we're going to go over to the AdvanceMed question bank and we're going to pick out a question just to show you approach for answering this particular question. So we're going to look at this question. Can you describe a time where you have experienced when the plan of the medical team was at odds with the idea of the patients and the family? So the question, you notice, started with describe a time. So this is of course a past behaviour question. Kind of big 3 words put together, but in essence a past behaviour question is used where they want to hear an example from you about something that is similar to a key challenge in the role that you're applying for. So for example, in this context, the example is essentially about the medical team being in conflict with the patient and their family. And so this is a key thing that happens in the role. In most jobs in hospitals in Australia, there's some conflict between the ideas, goals of the patient and their family and what's being recommended by the hospital team that's looking after them. And often it comes down to the resident to pick up on that first and try to deal with it first. There's a bit of evidence that past behaviour questions are better than theoretical questions because giving a real example, it's harder to sort of fib around versus an answer to a theoretical question. You can sort of talk about what you would do in a theoretical way, but it may not be that you necessarily do that if the situation came around. So that's the whole purpose of it. And of course we can use the STAR technique, that's a really bad star there, to answer a past behaviour question, and often this is the way they score these questions. So STAR stands for situation, i.e. what was the context you were in, where were you, hospital probably, what ward, what team were you working in, etc. Then the task, what was your role in the situation, which then leads into actions, things that you did in this example to get the job done, which segues into the final point, which is the result or the results of that particular example and your actions. Now, in my experience, particularly junior trainee doctors at interviews do very well in describing examples and the situation and the tasks and even some really good actions that they took in that particular example, but often fail to outline the actual outcome of the scenario. And this is really important, this is critical. This is what the panel is looking for to give a good mark. They want to see that all this action and activity leads to something good at the end of the day. So that's important. Okay, so getting back to our scenario situation where the medical team plan is at odds with the ideas of the patient and the family. So we start with the situation. So let's say we're a RMO on the medical ward and we are looking after a man who is elderly and has complex health conditions, right? And he has a gangrenous foot. Common situation that occurs, okay? Probably has diabetes, maybe some neuropathy related to that, maybe some heart failure, etc, etc. Okay, so then we move on to tasks. So our task as the RMO is we've been asked to prepare him for surgery. However, the patient and the family do not consent. And so we're the RMO left to deal with this. So the surgical team have come out, recommended, the consultants agreed, said that's the plan to the patient, but the patient is saying, no, I do not want my foot removed. Again, fairly understandable reaction in that sort of situation. So we need to, as a resident, unpack what's going on. Why are we in conflict and see if we can resolve this conflict. Now we're quite clear from the medical and surgical team perspective, we've tried all the other things that we can do in this situation and we're worried that obviously if the foot remains the way it is, it'll become septic and the patient will die and he is expecting to leave hospital at some point. So that then leads us to actions. So we sit down with the patient and their family and we listen, review the info they've had so far, explain why the team is suggesting that this is important. We find out what they're worried about, how this meets with their own particular goals of recovery and rehabilitation. We find out that firstly, there's a bit of grief. Secondly, the patient's not aware that there are really limited other options. Thirdly, we find out that the patient is worried about how they're going to get around and they're not aware of the options for prosthesis, so we're able to find one and show them how that works and perhaps get one of the prosthetic team to come up and talk to them and explain what's going to happen after the surgery and how we're going to help them to remain mobile. And perhaps that addresses a concern they have about some activities that they need to be able to get back to when they go home. Okay? And then we come to the important final bit, which is the results. This is the cell of the answer, if you like. Okay, so the patient consents. We don't stop there. They have a good surgery, unremarkable, able to leave hospital, which is great. They come back and get their prosthesis and they can mobilise, tick, tick, tick. And perhaps the family put in a thank you to the team. Right? So you've shown that you as a resident have a good way of communicating and listening and working with patients and families around their goals and explaining the recommendations of the medical team. So that's how you answer a past behaviour question like the one there. Can you describe a time you've experienced when the plan of the medical team was at odds with the idea of the patients and family?